Dr. Schultz at the Centeno-Schultz Clinic. It's hard to believe, but we've made it into March 2021. So as you know, each month we go into a new topic, and this month we're going to be talking about the low back. So today's topic is, do you have an irritated nerve in your low back? Well, let's get to it. This is the low back. It's got some building blocks. This is the front. This is the back. And as you can see are these little rascals that are coming out at each level. These are very, very important nerves that go into the hip, the leg, the knee, and they go all the way down to the ankle. So it's important. It's actually important if you have an irritated nerve. And you all know the classic Hollywood depiction of, I've got sciatica. Ow! Oh, I can't barely walk. Well, that's actually an irritated nerve in the low back. That's right. But like everything in Hollywood, it's not always accurate. So let's talk about the one-offs and what they look like and how that may actually be one of your problems. So as usual, I've got a little bit of a mnemonic. It's called BAT HIT. So we'll get started. Now these are signs and symptoms that you may actually have an irritated low back nerve. Number one, and I can speak directly to this, butt pain. I had unrelenting butt pain. I mean, it changed my life. People thought it was the piriformis, the obturator. I'll tell you, I had a disc herniation that was compressing a nerve. Number two, atrophy. That's just a fancy word for shrinking muscle. You may be working out in preparation for hot summer and the new bathing suits, but if one leg is getting smaller than the other, think that you may actually have an irritated nerve in your back. Number three is tingling. If you've been snowboarding or hiking up high and your toes and your boots get soaking wet and then they freeze, that terrible tingling when you get back to the cabin? That's what I'm talking about. If the toes are starting to tingle or if the toes are starting to curl, you may actually have an irritated nerve in your low back. Let's keep going on. So that's BAT, B-A-T. H, hip. The outside of the hip, not the groin, but on the outside, there's this bony prominence right here. It's called the greater trochanter. And we see patients every single day in clinic that are like, ouch, right here. Well, guess what? That's a tendon problem, and that tendon problem is due to an irritated nerve probably 75% of the time. So if you want treatment of your outside hip pain, consider whether or not you have something going on in your back. And then the ITB is that swath of fabric that goes from the outside of the hip. And you've seen those rascals at the gym. They're going up and down on their roller, just trying to get that piece of really tight tissue relaxed. Well, patients with chronic IT band dysfunction oftentimes actually have an irritated nerve in their low back. You see them all the time in the gym. And then T, twitching. Have you ever seen it? All of a sudden you've got jumping in your leg, your foot. That's due to irritation. The nerve is getting irritated. So don't get sucked into the idea that sciatica is the only sign or symptom that you may have an irritated nerve in your low back. There are many. Most importantly, why in the world should you care? Why should you be listening in this podcast, and why should you share this? Why? It's a warning sign. It's a warning sign that you've got a problem that warrants further investigation. If left untreated, guess what? The muscle shrinkage can get worse. The tingling and nerve damage can become permanent. The tendon can actually go on to tear. The IT band can actually create a huge problem, and whether you know it, the IT band is one of the key stabilizers of the knee. So the IT band affects the knee, and then twitching, you will have a problem. So Again, I'm going to answer this question in just a minute, Sabina. Signs or symptoms of whether I have an irritated low back, a nerve in the low back. Don't be a sucker and think you've got to have sciatica. Equally important, don't listen to your doctor if they say, nah, it's not an irritated nerve. Some of the signs and symptoms: butt pain, atrophy, tingling in the feet, IT band, hip pain on the outside, and involuntary twitching of the muscles. It's an important issue. It's a warning sign. It's sort of like that a warning sign. You know, you've got the car all packed up. It's Friday afternoon. The kids are there, and you're halfway down getting onto the on-ramp, and that red light turns on. That's right. It happens to me, too. It is a warning line that warrants further investigation. I'm going to take one question. Can it be so the question, thank you for Sabina, is could an unstable SI joint also irritate the S1 nerve? The question is this: what in the world is the sacroiliac joint? This is the lumbar spine. The lumbar spine descends into a bone called the sacrum. Right here is your waist bone, otherwise known as the ilium, where the sacrum meets the ilium. There's a joint which is right here. This joint is susceptible to injury, irritation, and can be a major cause of pain. It also, if unstable, can indeed irritate one of the nerves, giving rise to all these symptoms. If you found this helpful, please share it. Give us a thumbs up. Until next week, have a great March. Bye-bye.